Hi, welcome to Denver Wellness Digest. My name is Chris Perez, and today we'll be talking about dysthymia, or high-functioning depression. If you like this kind of content, hit subscribe and like below, and send us some comments requesting future content. We'd be really glad to provide you with what you want to hear about. Today, I've got back in the studio Harmony Wright, a fantastic nurse practitioner here at Alleviant Health Centers of Denver. So Harmony, welcome back today. We're going to be talking about what again?
Dysthymia, or persistent depressive disorder. Both the same, but you can kind of hear two different names depending on who's talking about it and when you were trained.
Yeah, I don't think I would say dysthymia offhand.
Yeah. So the DSM-5 was reconfigured, oh my gosh, about 9 years ago now. And so dysthymia became persistent depressive disorder. And so we're going to talk about that today, talk about what that looks like, talk about how you can recognize those symptoms, how we classify them, and then treatment options.
So Harmony, tell me, what are the symptoms of dysthymia then?
The symptoms are changes in sleep, changes in appetite, decreased energy or fatigue, problems with concentration, difficulty with self-esteem.
Gotcha. It's kind of hard for me to say, how is that different than kind of what a lot of us are experiencing as we've been working from home and not leading our regular lives. I've definitely been eating differently and sleeping differently. How can I really tell the difference between dysthymia and maybe I'm just really stressed out?
Well, it would be level of impairment. So how much is it affecting you, and how is it affecting you? And just like with sleep, right? If you're not on a sleep schedule, then I'm not going to say, oh, well, let me give you medicine right away. I'm going to say, let's first get you on a schedule. Let's stick to that schedule and see if it improves. Now, if you've already tried these things by the time you come and see somebody like me, and which is often the case, people have tried things. Like, people are out there like, I tried this, I tried that, and I'm still struggling.
Gotcha.
Then we're looking at, okay, so are you missing work? Are you missing out on family activities? Are you feeling joy? Are you enjoying your life? And that really speaks to how much it's affecting you day to day.
That's a really good point that I want people to examine for themselves at home is, am I enjoying my life? Sometimes is it spouses that push patients to come and see you?
I think that often the people in your life can be great supports when you do decide to get help, because sometimes people are worried about, if I see a mental health professional, what does that mean? Or should I? Or am I really struggling that bad? And often people in your life can say, yeah, I'm really worried for you. And I often will ask my patients, like, so what would your spouse say? Or what would your kids say? Or your friends say? Like, are they worried about you? Do you tell them how you're feeling? To really get some collateral data to, because sometimes we may not know how much we're struggling and other people see it, or the other way around. So definitely is important to rely on your support systems.
So Harmony, what's the difference between dysthymia and kind of the classic presentation of major depressive disorder?
Great question. So to some degree, dysthymia is less severe. So in order to qualify to say you have dysthymia, you don't need to have as many symptoms of depression, and they may not be as severe. On the other hand, dysthymia lasts longer. So the criteria of how long you've been experiencing it can be up to 2 years. It has to be 2 years for adults. So, which can be categorized by crying spells, suicidal thoughts, hopelessness. You have to have 6 out of the 9 criteria for major depressive disorder, and for dysthymia, you have to have 2 out of the 6. I think once we say it out loud to individuals, people are like, I feel that way, I feel that way. And so again, like you said, Chris, it's like, are you enjoying your life? And if not, what is it that you feel or you're experiencing that's getting in the way? And then you can meet with somebody like me and we can say, okay, well, that really sounds like it's depression, or it sounds like dysthymia. And major depressive disorder is more acute. Often we need to intervene. We're going to definitely go to a more escalated therapy sooner than later, because people are in more of crisis than dysthymia, which can speak to why people with dysthymia may not seek treatment for a while, and why we've seen this diagnosis come about. It's like, you've been feeling away this long, and what was going on? And so we see kind of a progression, right? And with dysthymia, just because you're not at such a severe level doesn't mean we don't want to intervene so you don't have a major depressive episode or develop major depressive disorder. So we'd want to be proactive and preventative with those individuals so that they can feel better and get back to their level of functioning.
I want to ask, so if you treat dysthymia, can you sometimes prevent escalation to major depressive disorder?
Yes. So that's what we would want to do. That's what we are always wanting to do. So that's why it's important to make content like this and share this with individuals, because we want to get you at the lowest level possible. We don't want to wait till you're completely in crisis, although we want to help then too. But if we do, what we can prevent is long-term complications of things such as major depressive disorder, which is the #1 most debilitating illness worldwide.
So Harmony, this sounds like something that a lot of people could be experiencing. How common is it? How prevalent is it?
In the United States, it's about 3 to 6% of the population, which is a lot. And in Colorado, though, we have about 40% of Coloradans have experienced one or more episodes of depression or anxiety.
Wow.
It's almost half of the state.
Oh my gosh, I didn't even think, until you said it that way, I just was thinking, yeah, 40%, that's a lot, but you're right, that's almost half the population.
It's a lot,
Wow.
yeah. That individuals with dysthymia can struggle with, it's not that bad because I'm not crying all the time, or I don't feel depressed. And that's interesting because it seems like it has been a theme for patients lately, or even friends or colleagues who are like, well, I don't feel anxious, or I don't feel depressed. And I'm like, but tell me, what you're telling me is depression. Like, you feel like you don't want to get up. You might get up out of bed, but it's taking a lot of effort. For younger folks that are like adolescents and teenagers, it can be characterized by chronic irritability. Irritability that persists for at least a year and doesn't really change. And so, you know, a lot of times it's interesting because it's kind of our healthcare system. We're trying to get away from that, right? I don't want to wait till you have high blood pressure.
Right.
I want to say, oh, let's exercise, let's eat right, let's manage our stress, right? We want to do the same thing with symptoms of dysthymia. Like, let's get you back on track to where you're feeling more joy, more enjoyment in life overall, before you get to a level that's like, I'm so down and out, I can't go to school, I can't go to work, I'm not functioning. You can get help now. Like, you do not have to wait until it escalates to a crisis or where you're just feeling terrible every day. Like, if it's a consistent low mood with very little fluctuation or any at all, then, you know, it's time to talk with somebody. You know, it's not as if you come and talk with me and I'm like, I go exactly to medications, or I'm like, you're going to need to go to a treatment or something like that. There is certain levels of care, and it's a spectrum. So we intervene at appropriate levels. We offer things like psychotherapy. We offer things like psychotherapy and medications. You know, and then we have escalating treatments. And so I think that then makes people just feel like, oh, this is just how it is, and I just need to deal with it.
Yeah.
Which I always feel like, man, I'm glad you're here. I wish you would have came in, you know, weeks or months earlier too, but you're here now, so we'll start here. But I think that also helps when individuals come in to be able to talk about this and the spectrum and how it affects people, then they can share with other people.
That's one of my favorite things that Harmony always says is like, I wish you would have come in sooner, we could have dealt with this before. How can people out there saying like, gosh, I have been irritable for the past 2 years, I haven't felt right.
Mm-hmm.
Who can I talk to?
Well, I think a lot of individuals do have a primary care provider, and so they might start there. And, you know, a lot of these symptoms can look like medical causes. So if you go and you're feeling like you have decreased energy, and it's been going on for a long time, your primary care doctor is going to rule out a lot of things. They're going to rule out vitamin D deficiency. They're going to rule out your thyroid dysfunction. And we do in psychiatry need to rule out medical causes to make sure that we're not, you know, treating something, you know, or overlooking a medical illness. And often, you know, primary care doctors, they are medically trained. So they're looking for a medical cause, medical root cause. And so they may not get to that level of assessment for anxiety or depression. And with stigma and people feeling nervous and with judgment and shame, individuals may not tell their primary care provider. There are certainly many skilled primary care providers who have a passion for mental health services, care, and access. And sometimes they don't always have time if you came in for something else, and so that's where somebody like us, that's our specialty.
Right.
We're going to that's what our whole session is going to be about, is how are you feeling, what are you thinking, and kind of going from there.
And do you check labs and other things like that to rule out medical causes as well?
Yes, thyroid dysfunction is so very common. So we always rule that out. We rule out, of course we definitely do a full medical history to make sure that there aren't any comorbid medical illnesses. That's not like a huge issue for us. We just always need to be aware of it, because we want to make sure that we're recommending and connecting you, number one, with medical services if you need it,
Yeah.
And making sure that we're communicating with your primary care provider so that we can give you the best care overall.
Great, that sounds great. I heard thyroid a couple of weeks ago as well, so I think maybe we'll be diving into the thyroid here. I mean, that sounds terrible. We'll be examining it. We'll be looking more into the thyroid in the future and how it affects mental health, because I think it's a very important kind of understated issue.
Absolutely, it is, and it's very, very common, especially as we age.
So Harmony, what could happen if people don't get dysthymia treated?
A lot of times what we see is comorbidities, and when we say comorbidities, what we're saying is other illnesses that occur, and including this dysthymia. And what you'll read about, and people are often talking about, is how dysthymia and depression are inflammatory processes, and so then it can lead to things like heart disease, high blood pressure, diabetes. It can also, if we don't treat dysthymia, you can also have comorbid psychiatric illnesses, substance abuse disorders, anxiety disorders. And so it kind of can cascade. And so that's why, again, we're like, let's stop it here. This is enough. You've suffered enough, and let's get you back on track so your body and your mind can heal and you can enjoy your life.
Yeah, because it seems like it'd be really easy to say, I don't feel great, I don't feel the worst I've ever felt, but maybe this glass of wine will help tonight, or like this slice of chocolate cake, or French fries. So I can see how that might start to get a little bit out of hand as well. It's really interesting to think about the link between inflammation and this low-grade depression that just kind of continues on.
I don't know if people really understand what that means.
Right.
Because it's like, okay, well, it's causing inflammation. Well, inflammation has your body on high alert. Your stress hormones increase. It's causing essentially stress on your cells. Well, your brain is made of cells, right? And that's where we have our emotion regulation and depression, anxiety, and every other psychiatric illness stems in our cells in our brain. So if they're stressed out and they wear out, they're not going to function as well, and then you can have things like depression, anxiety, dysthymia.
So Harmony, we've talked a lot about dysthymia, what it is, kind of what causes it, what it can cause. How do we treat it?
So we treat it like we treat most everything that we deal with in the mental health and psychiatric field. We discuss therapy options, we discuss if medications are appropriate, we discuss holistic and alternative complementary therapies. And by engaging in these therapies, so taking medications or doing psychotherapy is not to fix your life, but it's so that you can live your best life possible.
Oh, I like that. Live your best life possible. That's really kind of the core mission of our channel here, Denver Wellness Digest. I want people to live their best lives possible.
Absolutely. I talk about that all day long. That's like my job. I want you to feel good. I want you to feel good about yourself, where you see yourself in the world, and how you see the world and yourself and your vision of your life. And so that's really what people struggle with. That's what affects us day to day. And so I'm always looking at how to help them heal around that and help them feel good. And again, it's about enjoying your life. That's what we want. We want to enjoy our lives, right?
Yeah.
When we're not enjoying it, it doesn't go well.
No.
And our brain says, you know what, I'm not happy, and nothing else is going to be happy in the body. So we want you to feel good. We want you to take care of yourself physically, emotionally, mentally. And so we're looking at the whole picture here. We're looking at root cause. We're looking at mind, body, spirit, and how to help you, again, obtain your health, your wellness goals, so that you can then actualize through your treatment plans, through therapy, through your goals. And so those things are very exciting because they haven't always been accessible to the general population. But that's one of the exciting things about working here at Alleviate Health Centers of Denver. You can address your mental health wellness, not just your physical wellness, which is all tied together, right?